Multiple very commonly prescribed medications used to treat a variety of medical conditions, unfortunately, may be interfering with your sexual function. As a board certified fellowship trained urologist and specialist in sexual medicine, when I see a patient with any sexual dysfunction complaint, I'm definitely paying close attention to their medication list. And if you're having issues in the bedroom, I want you to pay attention to this video, pay attention to this list, see if any of these medications sound familiar and are in your cabinet at home. So I'm going to go over 8 very common medications that may be interfering with your sex life. Multiple very commonly prescribed medications used to treat a variety of medical conditions, unfortunately, may be interfering with your sexual function, either by decreasing your desire or libido, decreasing your arousal or response to sexual stimuli, interfering with your ability to orgasm, or making penetrative vaginal intercourse painful. As a board certified fellowship trained urologist and specialist in sexual medicine, when I see a patient with any sexual dysfunction complaint, I'm definitely paying close attention to their medication list. It's a really important part of working them up if that is causing or contributing to their issue. And if you're having issues in the bedroom, I want you to pay attention to this video, pay attention to this list, see if any of these medications sound familiar and are in your cabinet at home. And if so, it may be contributing to your issue, even if you've been on the medication already. And if you're on any of these medications and not have any sexual complaints, then don't worry. You don't need to go out and necessarily stop the medication, because these sexual side effects don't necessarily happen to everyone that is on this medication. Okay, so let's get into the list. Number 1 on my list has to be antidepressants, particularly SSRIs, or selective serotonin reuptake inhibitors. These are the most commonly prescribed antidepressants. Hey, they work. Antidepressants have really revolutionized mental health, and they help millions and billions of individuals dealing with depression and anxiety, however, commonly associated with a decrease in desire, decrease in arousal, and may make orgasm more difficult to achieve. Other types of antidepressants may be exceptions. Bupropion, mirtazapine, and vilazodone are exceptions and are unlikely to affect your sexual function. Number 2 on my list, oral birth control pills or oral contraception. Listen, I am a huge fan of birth control. Aside from preventing unwanted pregnancy, oral birth control pills have been found to lower your risk of ovarian cancer and uterine cancer. And oral birth control pills are one of the most common, if not the most common, medical form of contraception. For most users, they won't affect their sex life, but for some, they can decrease libido, and for a few, they can make penetrative vaginal intercourse painful. And so if that sounds like you may be recommended to try a different form of birth control like an intrauterine device or IUD, which is unlikely to affect your sexual function. Number 3, narcotic pain medicines, the Vicodins, the Oxys, Percocets. These lower your ability to orgasm. They disrupt the messaging from your genitalia to your brain. Number 4, benzodiazepines. These are medications that are prescribed for anxiety or relaxation, medications like Xanax or Ativan. They, while making you feel more calm and relaxed, also lower your desire and your arousal. Number 5 on my list, spirolactone. This is a diuretic medication which can be used for a variety of conditions. It can be used for high blood pressure, it can be used to get rid of excess water, it can be prescribed for acne, and it's even been prescribed in some cases for hair loss. The thing about spirolactone is that it blocks androgen receptors, so it blocks testosterone from binding to the receptor, and testosterone is an important part of desire. And so people on spirolactone may report lower libido. Number 6, blood pressure medication. There are certain blood pressure medications like beta blockers and clonidine that can also decrease libido or desire. Beta blockers and clonidine are also associated with a small risk of erectile dysfunction. And so they may be causing or contribute to difficulty getting it up. Number 7, antihistamines. These are used for controlling allergies and in some cases for treating GI reflux. Unfortunately, in some cases, they may decrease libido and arousal. And last on my list, number 8, anticholinergics. As a urologist, we use these a lot for treating a condition called overactive bladder, where the bladder goes too frequently or too urgently. Anticholinergics kind of sort of dry you out. They decrease secretion from mucous membranes. This can mean decreased lubrication and arousal. So there's my list. This doesn't include everything. It includes a lot of the most common stuff. It's really, really important that you talk to your doctor or prescriber first before considering or abruptly stopping or changing any of your medications. Please do not change your medication without discussing this with your healthcare professional who prescribed it. Some of these medications are dangerous to stop cold turkey. And in some cases, it's not beneficial to stop these medications. They're helping you in other ways that make it hard to either find an alternative or to stop. While when we can, if we can get off or decrease the dosage of some of these medications in those patients who are bothered, we can also continue to help you and work around these medications if necessary. And I want to reiterate, if you're already on these medications and not having any issues in the bedroom, please don't go out and say, hey, Dr. Milhouse on Down There Urology YouTube told me to stop this medication because it can ruin my sex life. I don't want anybody's doctor coming for me, okay? I hope this helps you. I hope you got empowered. I hope you learned something. And more importantly, I hope you subscribe, okay? So that you can join me every week for all things down there right here.